You're watching CTOM TV. Knowledge is power.
So HER2, as we mentioned in breast cancer, so there's a bunch of different things that can happen in HER2. You can have mutations. So HER2 mutations are targeted by drugs called neratinib, osimertinib apparently, dacomatinib, and tucatinib. There's also another drug called poziotinib. It's a new drug. It targets something called exon 20 mutations in HER2. And so this is a slightly different drug. So previously, afatinib and dacomitinib were used for exon 20 mutations. They're second generation EGFR inhibitors, ironically, but they also work for HER2 exon 20 mutations. But they don't work so well. You know, they'll work in some patients, but not all of them. So now this new drug, poziotinib, it's a smaller drug, it's a small molecule, and it has greater flexibility. So it's allowed to get into that binding pocket that's induced by HER2 exon EGFR exon 20 insertions. And it can get in there and it can turn off the drug better than those other ones. So once again, I like this comment here. It's small and flexible, so it can get to the cells and work better. That's a good point, definitely. And it probably also crosses the blood-brain barrier for that matter. So I think that's a great point, Michelle. Therefore, it can affect brain tumors. And not all HER2 targeted drugs can cross the blood-brain barrier. For example, ones that target overexpression, such as Herceptin and so on, they're large molecules, monoclonal antibodies, and they most likely can't cross the blood-brain barrier, so they can't affect brain metastasis. So once again, HER2 overexpression, the standard drugs are Herceptin, pertuzumab, a new drug called TDM1, another drug that I really like called TDXXD, which is what we call a drug conjugate. TDM1 and TDXD are drug conjugates. So that, in other words, they carry the Herceptin, and then they are a piece of chemotherapy attached to Herceptin. So they'll bind onto the outside receptor, and then they'll release their chemotherapy payload into the cell. So cells can lose their HER2 expression. The receptor can break off over time, and that's a bit of a problem because then these drugs won't work. They need the outside receptor to bind onto. And so the beauty of this new TDXD is not only does it release its chemotherapy payload into the cell with the receptor, the HER2 cell, but it also kills the cells next to it, which may have lost their receptor. So it's probably more, it's really effective when patients have low HER2 expression. And that's why I like that drug, because it's much more effective than the others when you have low overexpression of HER2.
Thank you for watching CTOM TV. Subscribe below and stay informed.